Good evening, everybody. This is a lecture of infection control related COVID-19 in critical care units. It is prepared by Ms. Huda Ahmed Muhawish, Administrative Nurse Manager, Critical Care Department, presented by Basil Al-Ma'abbadi, Clinical Nurse Manager in Critical Care Department. In our lecture learning objective today, at the end of 1 hour lecture, the attendee will be able to describe the coronavirus disease 2019, identify the mode of transmission of the SARS-CoV-2, identify the precaution for suspected and confirmed case of COVID-19, summarize the transmission-based precaution for COVID-19, demonstrate donning and doffing of PPE, personal protective equipment, for COVID-19 patients. Summarize the specimen collection for COVID-19 and discuss environmental cleaning as per Wiqaya recommendation. What do we know about coronavirus? Coronavirus are large family of viruses. Some cause illness in a people and other only infect the animal. Some coronavirus infect animals, then spread to people, and then spread person to person, such as Middle East Respiratory Syndrome, that's MERS-CoV, Severe Acute Respiratory Syndrome, SARS, Coronavirus Disease 2019, which it is COVID-19. And common coronavirus include some that cause mild upper respiratory illness like the common cold. What is COVID-19? COVID-19 or coronavirus disease 2019, it is a respiratory illness that can spread from person to person. The virus that cause COVID-19 is a new coronavirus, SARS-CoV-2, first identifying during investigation into outbreak in Wuhan in China. Initial case, patient reported visiting a large seafood and live animal market in Wuhan in China. How does COVID-19 spread? As you know, COVID-19 it's spread the same way the flu and other respiratory disease spread. So most of the respiratory disease, it is their spreadness, it is near to COVID-19, which is spread through respiratory droplets produced when infected person cough or sneeze. These droplets can land in the mouth or nose of a people who are nearby or possibly be inhaled into the lung. Between people who are in a close contact with one another within about 6 feet. Standard precaution. Always, as a healthcare worker, you should follow and take care of the standard precaution because it will prevent and protect, it will prevent the infection, spread of infection, and it will protect you as a healthcare worker. A set of practices that are applied to the care of patients regardless of the state of infection control, suspicion, or confirmation in any place where health services are provided. Always, we should take care of hand hygiene and respiratory hygiene are essential preventive measures. The standard precaution respiratory hygiene ensure that the following respiratory hygiene measures are used. First, ensure that all patients cover their nose and mouth with a tissue or elbow when coughing or sneezing. Once you receive patients, or once the patient came to you, directly over them by a medical mask, surgical mask, to prevent, or to the patient, to prevent spread of infection, especially if that patient have suspected COVID or confirmed COVID, and you are keeping him in the waiting area or public area or in cohorted room. Perform hand hygiene after contacting with respiratory secretion directly. الهاند hygiene, healthcare workers should apply World Health Organization 5 minutes. These 5 moments, always you will see in every hospital, every department and unit in the hospital, you will see the 5 moments of hand hygiene, which include you should do hand hygiene before touching a patient, before any clean or aseptic procedure is performed, after exposure to body fluid, after touching a patient, and after touching a patient surrounding. الهاند hygiene, we have many steps for hand hygiene, including either cleaning the hand with alcohol-based hand rub or with a soap and water. It depends in a procedure and depend in the exposure to the microorganism. Alcohol-based hand rubs are preferred if the hands are not visibly solid. But washing hand by soap and water, it is preferred when they are visibly solid. The patient placement, where we can keep our patients. If admitted patients, place a patient with known or suspected COVID-19 patient in a single person room with the door closed. Always keep the door closed to prevent the spread of infection, because most of these patients, they are coming with coughing, sneezing, and all the microorganism, it will be flow through the air. So please take this note to keep all the door of the patient closed. The patient should have a dedicated bathroom. Airborne infection isolation room should be reserved for a patient who will be undergoing aerosol generation procedure. We mean here as a negative room pressure. A negative room pressure is a particularly critical when something like COVID-19 strikes. Patients with suspected or confirmed COVID-19 should be brought back to an appropriate treatment area as soon as possible in order to minimize time in AR. Why? Because always the AR, it is open area, and we don't want to spread the infection and will make more risk in our healthcare workers. Using recirculated room air, provided the air first passes through the high efficiency particular air HEPA filter. The transmission based precaution, here how the transmission of COVID-19 it will be happen. So we have 3 precaution we should take care about it: contact precaution, droplet precaution, and air precaution. For droplet precaution and airborne precaution, it is depend on what you should do and what the procedure can be done for the patients. Transmission-based precaution, a scenario for any suspected or confirmed case of COVID-19, you should use standard precaution, contact precaution, and droplet precaution, which we are using here Like late recommendation, they are mentioning that you can use a surgical mask if you will not do any invasive procedure for the patients. The second one, for any suspected or confirmed case of COVID-19 and a urethral generating procedure, the AGP, here what we mean, if you will do any direct contact procedure for the patient, suctioning or giving bag valve mask, doing ambu bag for the patients, all of this you can use standard precaution plus contact precaution and airborne precaution. The PPE, personal protective equipment. First, the gloves. We have two types of the gloves, sterile and non-sterile gloves. Gloves are essential item of PPE. We are using the gloves to prevent the healthcare worker from being exposed to the direct contact with the blood or body fluid of an infected patient. But using the gloves, that's mean it is not replacing hand hygiene. You should do hand hygiene before and after wearing the gloves. Gown. Gown are used in addition to gloves if there is a risk of fluids or blood from a patient splashing into the healthcare worker body. A plastic apron should be used in addition to gown if the material of the gown is not fluid repellent. That means it is not preventing the fluid to go inside, and the task to be performed may result in a splash into the healthcare worker body. So sometimes you are doing invasive procedure, or sometimes we are doing suctioning, and all the body fluid, maybe it will come to the healthcare worker. The gown, it is not protective. That's why we are using plastic apron. Facial mucosal protection, or like we know everyone, face shield, goggles, and eye visor. Mask and eye protection such as eyewear and the goggle are also important of PPE and are used to protect the eye, nose, or mouth mucosa of the health care worker from any risk of contacting with a patient respiratory secretion or splash of blood, body fluid, secretion, or excretion. There is a preferred PPE and acceptable alternative PPE we are using in COVID-19 patient. For preferred PPE, we are using N95 or higher respirator. For accepted alternative PPE, we are using face mask. If you will see here in the picture, in the right side and the left side, they are wearing the same PPE, except the difference where in the mask. By the left side, he is wearing N95, but the right side, he is wearing surgical mask. How and when to practice hand hygiene?
The 3M 1860 is a cone-shaped particulate respirator and surgical mask. The 1860S is a smaller version of the 1860. Follow these instructions each time you don your respirator in order to achieve a proper fit. Begin by cupping the respirator in your hand, holding the metal nosepiece at your fingertips. The straps should hang freely below your hand. Place the respirator under your chin with the nosepiece up. While holding the respirator in place, pull the top strap over your head with the opposite hand and position it high on the back of your head above your ears. While still holding the respirator firmly on your face, pull the bottom strap over your head and position it around your neck below your ears. Make sure the straps are not twisted for increased comfort. Place the fingertips of both hands at the top of the metal nose strip and mold the nose piece to the shape of your nose using both hands. Push inward while moving your fingertips down both sides of the nose piece. Always use two hands when molding the nose piece. Pinching with one hand may result in improper fit and less effective respirator performance. Perform the following user seal check each time the respirator is put on. Cup both hands over the respirator, covering it as much as possible and being careful not to disturb the position of the respirator. Inhale and exhale sharply. If air leaks around the nose, readjust the nose piece for a more secure seal and repeat the user seal check. If air leaks around the respirator edges, adjust the position on the face and the straps along the sides of the head. Repeat the user seal check. Do not enter a respiratory isolation or other hazardous area where respirators are required until you are assured you have a proper fit. If you have difficulty achieving a fit, review the respirator user instructions located inside the packaging or refer to the instructions on the 3M 1860 Wear It Right poster to be sure that you are following the correct procedure. If you are still unable to achieve a fit, see your supervisor or representative from your infection control, employee health, or safety department. Do not enter a hazardous or infectious area. To properly remove the respirator, do not touch the facepiece. Slowly lift the bottom strap from around your neck up and over your head while keeping the respirator seated against your face. Lift off the top strap. Carefully remove the respirator without allowing the outside of the respirator to come in contact with your body, and perform hand hygiene. 3M recommends you practice this removal procedure until you are proficient and comfortable with the procedure and before actual use of the respirator for the first time. Leave the hazardous area immediately and replace the respirator if it is damaged, difficult to breathe through, or contaminated with blood or body fluids. Follow your facility's infection control policies and procedures for guidance on how frequently you should replace your respirator. Follow the proper fitting procedures each time you wear the respirator. When in doubt, review the user seal check instructions. If a proper fit cannot be achieved, do not enter the area requiring respiratory protection. Follow up with your supervisor. Keep in mind that when you are wearing a respirator, it helps reduce potential exposures if the respirator fits you properly, you wear it during all times of exposure, and use of the respirator is under an effective respiratory protection program as required by OSHA 29 CFR 1910.134. Refer to the OSHA website at www.osha.gov for the most current information about use of respirators. Contact your 3M sales representative or call the 3M Healthcare Customer Helpline for information on personal protective equipment, including the respirators described in this training, and to learn more about the other elements of a respiratory protection program.
Welcome back. Always remove N95 respirator outside the isolation room. Don't forget this note. N95 fit test. So all healthcare worker, they should do fit test for themselves to know which size of N95 it is fit for them, to ensure from their safety and to protect their self. Fit test is used to figure out the type of respirator a healthcare worker may need and what level of protection the mask will offer for them. Fit testing be conducted annually. That means sometimes we are doing every year and sometimes they are doing every 2 years, and repeated whenever an employee reports or the employer or the physician or the licensed healthcare professional makes visual observation of the change in the employee physical condition that could affect respirator life of it. For example, facial scarring, dental change, cosmetic surgery, or an obvious change in body weight. So if you note any change in the body, or especially in your face, you lose weight, or you sometime increasing the weight, so please go directly and check for your respirator fit test. In 95 fit test, they are doing first the sensitivity test. After that, they will do the fit test. The sensitivity test, this test is done to assure that the person being fit tested can detect the better taste of the test solution at very low level. The sensitivity test solution, they are diluted of fit test solution. But for the fit test solution conducted to verify that a respirator is both convertible and correctly fit for user. Use personal protective equipment when caring for the patients with confirmed or suspected COVID-19. COVID-19 patient healthcare personnel, they must first receive comprehensive training on when and what PPE is necessary, how to do done, that's mean put on and doff, take off the PPE, limitation of PPE and proper care, maintenance and disposal of the PPE. That's mean all healthcare workers, they should take intensive training. It will be enough for them 2 to 3 hours for 4 hours to understand how they can wear the PPE and how they can remove their PPE by correct way. After that, they should do demonstrate or demonstration competency in performing appropriate infection control practice and procedure. All this, it will be happen by education, and it will be supervised by infection control. We have some strategy to optimize the supply of PPE and equipment. Optimization strategy for PPE offer the option for use when the PPE supplies are stressed, running low, or absent. Sometimes we are receiving more PPE, but misuse of that PPE, it will let the PPE so finish very fast. Contingency strategy can help stretch the PPE supplies when a shortage are anticipated. That's mean when you think there is shortage in PPE, it's coming because during pandemic in all the world, it will happen that shortage of the PPE because each hospital, they are asking for their supplies, and it will take time until it will develop to their hospitals. For example, if facilities have sufficient supplies now but are likely to run out soon. We have also crisis strategies can be considered during severe PPE shortage and should be used with the contingency option to help stretch available supplies for the most critical needs. So we are keeping our supply, we are keeping, for example, N95 for a critical needs. That's mean if we will do some invasive procedure or a urethral procedure. Develop strategies that identify and extend the PPE supplies so that recommended PPE will be available when needed. When using PPE optimization strategies, training on PPE use, including proper donning and doffing procedure, must be provided to healthcare provider before they carry out patient care activities. For example, like most of the hospital, they are canceling their elective and non-urgent procedure and appointment to save their supplies, to protect the patient and prevent spread of infection, and related to many reasons. Use reusable PPE that can be reprocessed, especially if there is severe shortage of the PPE. Consider allowing healthcare provider to extend use of respirator, face mask, and eye protection beyond a single patient contact. So we are using N95. Sometimes you are using this N95 for one use, then you throw directly after you finish from your procedure. So from management for that PPE, you will extend the time of using that your N95. Reserving sterile gowns and gloves for urgent sterile patient procedure such as surgery, and reserving respirator for aerosol generating procedure and patient care with airborne transmitted disease risk like tuberculosis, measles, and varicella. For aerosol generating procedure, number of healthcare provider exposed should be limited. For example, for AGB, that aerosol generated procedure, like bronchoscopy, cardiopulmonary resuscitation, non-invasive ventilation, for example, BiPAP and CPAP and high frequency, surgery, tracheal intubation, manual ventilation, sputum induction, and suctioning. So we should take care during this procedure. How we can take a specimen from the patients? At minimum, respiratory material should be collected. We have two types: upper respiratory specimens and lower respiratory specimens. For upper respiratory specimens, nasopharyngeal and oropharyngeal swab in ambulatory non-intubated patients. For lower respiratory specimens, what is more dangerous, especially if the patient become critical, sputum, if produced and or endotracheal aspirate or bronchoalveolar lavage in a patient with more severe respiratory disease, intubated. Not high risk of aerosolization, adhere strictly to infection prevention and control procedure. Nasopharyngeal and oropharyngeal swabbing, clinical examination.
COVID-19 diagnostics, performing a nasopharyngeal or oropharyngeal swab. It is essential to follow proper infection control measures when samples are collected from patients with a suspected coronavirus infection. Among other things, the examiner should wear an N95 respirator mask, gown, protective goggles, and gloves. To save resources, we will refrain from using each of these items in this video, and instead only show the technical details of sample collection. Let's begin with the nasopharyngeal swab. The patient should be alert and cooperative. Allow them to first blow their nose. The patient should sit in a relaxed and comfortable position during the sample collection process. Tilt the patient's head back slightly and support it with your non-dominant hand. If necessary, lean the patient's head against a wall to minimize jerky movements. Stand slightly offset from the patient to avoid the risk of contamination in case of a sudden cough or sneeze. Be sure to advise the patient of potential discomfort during sample collection and let the patient know that they are welcome to close their eyes. Sample collection should only be completed using sterile swabs made from artificial cotton with flexible plastic shafts. Calcium alginate swabs or swabs with wooden shafts must not be used. These materials can inactivate viral particles or inhibit PCR tests. Furthermore, wooden shafts are more likely to cause patient injury. Hold the swab like a pen between the thumb, index, and middle fingers. Maintain a loose grip that allows the swab to accommodate any resistance encountered during sample collection to reduce the risk of injury. Avoid using the following hand position during sample collection. Start by inserting the swab horizontally into the left or right nostril. Carefully advance the swab while maintaining a course that is close to both the septum and the floor of the nose, parallel to the palate. Do not advance the swab upwards, but instead straight back until resistance is felt as the swab reaches the posterior nasopharynx. When collecting samples from an adult patient, this corresponds to a travel distance of approximately 5 to 6 centimeters or 2 inches. Leave the swab at this depth for a few seconds while gently wiping the wall by twisting the swab shaft. Slowly and gently remove the swab. Immediately insert the swab into the sample collection tube, which may contain 2 to 3 milliliters of viral transport media. If a nasopharyngeal swab cannot be collected for any reason, an oropharyngeal sample can be also collected through the mouth. Again, inform the patient that the smear will feel uncomfortable for a short time and may trigger a gag reflex. Ask the patient to open their mouth wide, protrude their tongue forward, and say "ah." Depress the patient's tongue using a tongue depressor. Gently insert the swab into the oral cavity without touching the lips, teeth, tongue, hard palate, or soft palate. These surfaces should be avoided as they are often colonized by a wide range of microbes. Collect the sample from the back wall of the throat. Twist the swab shaft gently but thoroughly, sampling the oropharyngeal wall. Just as with the nasopharyngeal swab, the oropharyngeal swab should now be placed into the sample collection tube and sent to the laboratory as quickly as possible.
Welcome again. We'll talk now, after we did specimen collection, how we can send this and how we can store it. Store sample between 2 and 8 degree for less than 48 hours. Place specimen for transport in a leak-proof specimen bag, secondary container that have a separate sealable pockets for the specimen. For example, plastic biohazard specimen bag with a patient name label in the specimen container, primary container, and clearly written laboratory request form. Don't use pneumatic tube system to transport specimen. For especially COVID-19, you should send this through Hesson system. So once the patient came to you in your units, you will request for Hesson number. Then after that, you will take the swab. Then you will put it with Hesson number. Then you will call for SIMSA on their number, and directly they will come to pick up the sample, and they will send it to the lab designated for COVID-19 investigation. Environmental cleaning and disinfection. In patient room housing, COVID-19 patient should be cleaned and disinfected at least daily and at the time of patient transfer or discharge. We prefer also to clean this one every each shift to increase the safety for the healthcare workers. More frequent cleaning and disinfection may be indicated for high touch surface and following aerosol procedure. For example, a table, a hard back chair, a door knobs, light switch, and remotes, handle, desk, toilets, and sinks. environmental cleaning and disinfection. This is a picture of what available here in Ministry of Health for HamaSurf solution. So we are doing cleaning and disinfection of the environment surface should be approved by Ministry of Health disinfectant. For example, hydrogen peroxide, alkaline ammonium chloride, fourth generation that should be used in pre-cleared hard non-porous surfaces in accordance with manufacturer instruction for environmental surface disinfection. After patient transfer, you should do terminal cleaning using manual method and or ultraviolet irradiation or hydrogen peroxide dry mist or vapor. Also we are saying about that it is fogging, which we are fogging the room of the patients by fogging solution. How we can transport COVID-19 patients? We should first notify the receiving healthcare facility. It is preferable to use a negative pressure filter ambulance or fitted with HEPA filter coupled ventilator when transporting patient on mechanical ventilator. You should wear your complete PPE, wear N95 if aerosol generation procedure are suspected to protect the healthcare worker and all transportation team. Avoid the movement and transport of patient out of the isolation room or area unless medically necessary. The use of designated portable X-ray, ultrasound, echocardiogram, and other important diagnostic machine is recommended when it's possible. If transport is unavoidable, the following should be observed. Patients should wear a surgical mask during movement to contain secretion. Use routes of transport that minimize exposure of the staff, other patients, and visitor. Like this picture in the right side, that's what we're mentioning. Transportation capsule. It is negative pressure capsule. We are keeping the patient inside and transportation patient from ward or from units to other units. Also, when we are transferring the patients from hospital to other hospitals. Notify the receiving patients. I think this is double slides. Remove your PPE in receiving units, hospital, and do hand hygiene. Used linen should be left in the receiving units. Put it in water soluble bag, then put in hamper designated for infectious linens. Clean and disinfect all the equipment used during transfer by proper disinfectant and follow contact time 10 minutes before return to the units. And please don't forget terminal cleaning for the patient room after discharging with a proper disinfectant. Also, if you are using this transportant capsule, you should make sure to clean this capsule by recommended solution for the clean to protect the healthcare worker and to be safe transportation of the patients in next time. The following also should be noted. The outside of gloves, mask, goggles, and face shields are contaminated. So make sure don't touch your face or your body by outside surface. Never wear surgical mask under N95 mask because it is preventing the proper fitting and sealing of the N95 mask, thus decrease its efficiency. It will allow the air to go through N95 from leaking area, and it is not giving N95 the benefits for the patient, for the staff, or for healthcare workers. For female staff who wear veils, the N95 mask should always be placed directly on the face behind the veils and not over the veils. In this instance, a face shield should also be used along with the mask to protect the veils from droplet sprays. Whenever possible, use either disposable equipment or dedicated equipment, for example, a stethoscope, blood pressure cuff, and thermometers. Here we are implementing safety practice for critical healthcare workers who may have had exposure to a person with suspected or confirmed COVID-19 patients. Pre-screening, employee should measure the employer should measure the employee's temperature and assess symptoms prior to them starting work. And ideally, temperature check should be happen before individual enter the facility. Like nowadays, in each hospitals, they are keeping some staff to check the temperature of all employee coming to their duties. And also regular monitoring as long as the employee doesn't have a temperature or symptoms. They should self-monitor under the supervision of their employers' occupational health programs. That means even if you don't have temperature, maybe you will be signs symptoms later on. So you should monitor yourself. Wearing mask, the employee should wear a face mask at all the time while in workplace for 14 days after last exposure. So once they feel that they are exposing to suspected or confirmed case, so they should keep the face mask on their face for 15 days from last exposure. Employers can issue face mask or can approve employee supplied cloth face covering in the event of shortage. And please always keep social distance. The employee should maintain 6 feet and practice social distance as work duties permit in the workplace, especially during the endorsement time between the shifts. How we can management how we can do management for our healthcare workers who had contact with a patient with COVID-19 infection. Self-monitoring, like we mentioned before, means that the healthcare worker should monitor themselves for fever by taking their temperature twice a day and remain alert for any respiratory symptoms, for example, cough, shortness of breath, or if there is any sore throats. Active monitoring, establish regular communication with the potential exposed people to assess for a presence of fever or respiratory symptoms, like for example, again, cough, shortness of breath, or short or sore throats. So the very important for us how we can manage these people by self-monitoring and active monitoring. Close contact. A, being within approximately 1.5 meters of a person with COVID-19 for a prolonged period of the time more than 20 minutes, such as caring for or visiting the patient or sitting within 1.5 meter of the patient in healthcare waiting area or room. And B, having unprotected direct contact with infectious secretion or excretion of the patient, for example, being cuffed on and touching using tissue with a bare hand. This is some examples how we can do it. So prolonged close contact less than 1.5 meter of distance, more than 20 minutes, with asymptomatic confirmed positive 19 COVID patient or symptomatic confirmed COVID-19 patients wearing a face mask, for example, source control. So here, if there is no PPE or not wearing face mask or respirator, we'll go to medium active and swab and exclude from work till negative result came. This for the people whom they expose for COVID-19 patients. If the patients, if the staff exposed, it is not wearing eye protection, not wearing gown or gloves, or wearing all PPE but using face mask for AGB and protected. So we are dividing the staff or dividing healthcare worker to low, self-delegated with supervision or none. Here, the same, but not wearing a face mask. So exposure category, it will be high for not wearing face mask or respirator, or if there is no PPE. Recommended monitoring, it will be active, and nasopharyngeal or swab and work restriction, it will be swab and exclude from the work for 14 days from last exposure. And a different also here, if the patients, if the staff not wearing eye protection with no AGB, protected with complete PPE, the exposure category, it will be low. The recommended monitoring, it will be self-delegated with supervision, and nasopharyngeal swab, it is not recommended and no need to take a swab from them until if they have signs or symptoms that they got it COVID-19. Last thing, take home message, always minimize AGBS. That's mean try to decrease not important invasive procedure. Always minimize the people inside the room. So if you will do a procedure, it is enough if you will use it by 2 or 3 person in the room, but please don't exceed the number, because if there is any exposure, that's mean all the healthcare provider, they will be exposed for COVID-19 positive patients. Always minimize the procedure and procedure time. Do it fast with a high quality. Sure. Always minimize exposure and always think of your safety and of others. Because if you protect yourself, that's mean you protect your colleague and you protect other healthcare worker and you protect your family in the home. Thank you.